Okay, today's date is July 11th, 2012. We're here with Sherry, and Sherry has significant neck pain that's been around for a year. Sherry, what we're going to do first is I'm going to ask you to turn your head as far as you can to the right, please. And now to the left, please. And now you can bend your head back. And you can bend your head down. And that's significantly restricted, even bending down. Is that correct? Can you bend your head down any further than that? That's a significant restriction. Okay. How much pain do you have in your head right now, in your neck right now?
On a scale 1 to 10, I would say probably 7.
With 10 being the worst?
Mm-hmm.
Okay. And you've had chiropractic, which didn't help.
Correct.
And you have now gone through 25 of 28 sessions of vertical axial decompression, correct?
Correct.
And that hasn't helped.
Correct.
And then you're coming to me for evaluation of what might be going on, okay?
Yes.
And you did draw my attention on my questioning to one root canal in number 4. How long has that been there?
Oh, probably about 15 years.
Okay, 15 years. Okay, and I just asked your permission to make a local anesthetic injection into your tooth.
Mm-hmm.
And we're ready to do that now.
Yeah.
Thanks. Okay, Sherry, we just did your injection, and that was only about 30 seconds ago, right?
Mm-hmm.
Okay, please bend your head down. Further. Please bend your head back as far as you can. Please turn your head to the right as far as you can. Now bend it back and turn it the other way. Okay, what do you notice in your neck right now?
The discomfort level is slightly down.
Slightly, okay? You came in, you said it was about 7 on a scale of 10. What would you say it is right now?
Probably 5 to 6.
Okay, we'll wait another moment, okay?
Okay.
I just told you, we just measured you, and you got an extra
18%.
18 degrees to 20 degrees motion, flexion extension.
Yeah.
What do you think of that?
I think that's great.
And there's less pain when you bend your head down, is that correct?
Correct, yeah, there's not near as much discomfort.
All right, if you would rate that for me, please, at least the flexion component. How much pain has that dropped?
I would say it's probably on a scale of 3 now.
Dropped from 7 to 3?
Yeah.
Well, I'm really happy about that.
Yeah.
You too?
Yes.
Turn your head to the right and the other way. All right, what's your overall level of pain right now? Overall level, including what we just did with your flexion extension.
I would say with this direction, it's probably about 3 also.
And it was a 7 before?
Correct, yeah.
All right, what about right direction?
I would say that actually hasn't changed much.
That hasn't changed much.
No, I'd still put that as probably 6.
Okay, thank you. I appreciate your honesty. By the way, if I'd like to post this on YouTube, do I have your permission?
Yeah.
Thank you. Sir, what do you think of what you just saw?
Well, after 1 year of 2 multi-month chiropractic sessions who couldn't do any real help, I mean, more help's been done in the last 30 minutes than the last year. So I'm very pleased.
Are you surprised to see that kind of improvement in her range of motion?
Yes, yeah. Yes,
Okay. Do I have your permission to leave you on YouTube as well?
Yes.
Thank you. This is her husband. Larry?
Brent.
Brent. Whoops. This is her husband, Brent. Okay, Sherry, we just found out that you have had breast augmentation, then reduction, leaving you with scars. And I muscle tested you, and I found that one scar underneath your right breast tested positive. And with your permission, I did neural therapy to it. I injected it. And what we'd like to do now is just check the range of motion that you got. So bend your head back as far as you can. As far as you can. Bend it down, touch your chin to your chest, please. Oh, okay, and now turn your head to the right. Turn it to the left. And what would you say your degree of discomfort is now?
Probably a 1. Yeah, and it's probably still 5, 6 here.
5, 6 that side, but turning it to the left, you're now rating it a
It is
1. Bending it down, you're rating it a 1. And I think that's even better range of motion than you had before, the last one. So your thoughts at this point?
I'm pretty impressed. Pretty impressed. I'm just scared I don't want any more shots.
And I didn't touch your neck, did I?
No.
Okay. Had you been given pain pills for your neck?
No.
No. Okay. Had they offered it to you?
Not at a chiropractor's, no.
Oh, okay. You didn't go to a medical doctor. You went to a chiropractor.
Correct.
Okay. Thank you. And you're okay with this part also being on YouTube, correct?
Yeah.
Thank you. Sherry, what would you say if I told you that when you walked in here, your flexion extension was a total of 90 degrees, okay? Now your flexion extension is a total of 116 degrees.
Wow, that's really nice.
We just got another 6 degrees of flexion extension just by doing the breast scar. When you walked in, your left rotation was 64 degrees. It's now 84.
That's really nice.
Your right rotation was 70 degrees. It's now 78.
That's great. I'd like it to be a little better than that.
I know. I didn't touch your neck.
Right.
That's what's important, right?
Yes.
And tell us again what the level of pain is. Move your head around. Your overall level of pain. Scale of 10, 10's the worst, 7 is what you walked in the door with, 0 is no pain.
Yeah, I'd say 1% for up and down and to my left. And to my right, it's still between 5 and 6.
5 and 6. Okay, when you said 1%, you meant 1, correct?
Correct,
Down
yes.
from 7 to 1.
Yeah.
Brent, what do you think about what you just saw?
It's the least amount of pain she's been in quite a few number of months, perhaps the last year. That's pretty impressive, how things are connected in the body and you don't realize how they're all connected.
Is this something you would recommend to other people?
So far, yes.
Does this also help to explain to you why there's people walking around in chronic intractable pain and they can't get rid of it?
Because they're not treating the cause, the source.
Right. Thank
Right.
you.
Thank you.
And I would deal with it.
Well, I just told you that I don't want to inject your neck.
Yeah.
And you have a smile on your face, right?
Yeah.
But you told me you would be willing to take it if you would get absolutely full rotation, correct?
Right. Correct.
Okay, now let me explain why I don't want to.
Okay.
I think the tooth is a major problem. And I don't like to go to the destination of a problem when I've got a possible source of the problem. That's why I did what I did with regard to your tooth and the scar. I'm looking for disturbances in your body that could have set you up for this pain because you didn't have an accident. There was no motor vehicle accident, and your neck x-ray was next to normal. I didn't see anything wrong with it. And that's one reason why x-rays are lousy and studies are lousy at trying to pinpoint the cause of a pain or a problem. They don't look at the cause. You can have a terrible x-ray and no pain. And you can have a normal x-ray and hear your classic example and you've got major problems. So we know that the tooth is a problem, and with a weight on your autonomic nervous system like that, I don't want to go shooting your neck. And I know you would do it. That's what you came in for, right? As far as your breast goes, generally a somatic scar, meaning a scar on the skin, I only need to do once. Sometimes I need to do it a second time. Rarely do I need to do it a third time. In your particular case, you had a lot of scarring in the scar on the south side of your breast. And the purpose of that was to try to break it up and with the local anesthetic take it out of the neurological circuit. And doing that really added to the range of motion. You now have near normal range of motion. Certainly flexion extension is a stunning improvement.
Right.
So no more injections for you today. You're going to go to a dentist. You also have an amalgam tattoo, which is dangerous. That's a focus of disturbance too. And I didn't find any other disturbances in your root canal teeth, fortunately.
Okay.
All right?
All right, great, thank you.